Today, let's explore an interesting topic, the earliest indicator of kidney issues. It might come as a surprise to many. The kidney, an essential organ in our body, functions as a sophisticated filter. It's responsible for transforming blood into urine. What's remarkable about the kidney is its active role in processing bodily fluids. Consider this example. If you consume about 8 glasses of water daily, which is approximately 2 liters, you would expect to pass a similar amount of fluid. However, the kidney's activity is much more extensive than this. In a single day, it handles around 180 liters of fluid, equivalent to 760 cups. This shows the kidney's incredible efficiency in reprocessing. It's like a powerful recycling machine, efficiently managing proteins, nutrients, hormones, and nearly all the water we intake. One major cause of kidney disease, including the most severe form known as end-stage renal failure, is linked to diabetes. This condition is referred to as diabetic nephropathy, where nephro stands for kidney and pathy denotes disease. High blood sugar levels are a primary factor in kidney damage in this scenario. Here's how it works. Elevated sugar levels in the blood can interact with proteins in the body, leading to a process known as glycation. This is where sugar molecules bond with proteins, altering them significantly. These altered proteins, known as advanced glycation end products, can accumulate and cause harm. They can clog the nephrons, the tiny filters in the kidneys, impairing their ability to filter effectively. This highlights the importance of managing blood sugar levels to maintain kidney health. The primary method for detecting kidney disease is by checking for protein in the urine. Normally, protein is recycled in the body, but when the kidneys are damaged, this protein ends up in the urine instead. This not only indicates kidney damage, but also results in lower protein levels in the blood. A common sign of this is edema, which is swelling due to fluid accumulation in various parts of the body, like the face, hands, and legs. An interesting aspect of kidney disease is its slow progression. It can take up to a decade before the first symptoms become noticeable. One of the earliest symptoms of kidney disease is nocturia. This condition involves frequent urination during the night, making it hard to maintain bladder control until morning. This symptom is particularly relevant because it's also commonly seen in diabetic patients. Since diabetes often takes about 10 years to manifest noticeable symptoms, it's not surprising that kidney issues are closely associated with diabetes. Diabetes is known to impact 4 key areas of the body: the kidneys, eyes, nervous system, and arteries. Focusing on the kidneys, when they are affected by diabetes, you often find protein in the urine and a reduced rate of filtration. This means the kidneys aren't filtering as they should, leading to a buildup of toxins and a loss of important nutrients, including amino acids. This can result in significant swelling, known as edema. However, because it can take up to 10 years for these symptoms to appear, it's challenging to immediately link them to their cause. From my experience, one effective way to address nocturia, a common symptom of kidney issues, is by managing blood sugar levels. Let's delve into that topic a bit more. In medical discussions, diabetes is often described as a condition where blood sugar levels are not properly regulated. The focus is usually on controlling or managing diabetes, including its symptoms and complications. However, there's less emphasis on actually correcting the underlying issue. One key aspect that's often overlooked is the patient's diet, particularly their sugar and carbohydrate intake. The average American diet is high in sugars and carbs, including hidden sources like bread, pasta, cereal, and crackers. Despite the known connection between carbohydrate intake and diabetes, there's a lack of specific guidance from major health organizations like the American Diabetes Association on how much to reduce carb intake. Instead, the focus is on managing diabetes and its complications through various means. For instance, fluid retention is managed with diuretics, high cholesterol with statins, high blood pressure with medication, and blood sugar levels with drugs like metformin and insulin. But this approach raises a question. When blood sugar is managed with medication, where does the sugar go? It doesn't just vanish. It's redistributed within the body, to cells, the liver, around organs, or converted into fat. This leads to another concern: the potential complications from the medications used to manage diabetes. It's a complex issue that requires a more holistic approach, considering both dietary habits and medical management. If you're dealing with kidney issues, looking to prevent them, or frequently waking up at night to urinate, there are several steps you can take to improve your situation. The first and most straightforward step is to lower your blood sugar levels. This can be achieved by adopting a ketogenic diet, which focuses on low-carb, high-fat foods. Another effective strategy is intermittent fasting. By eating less frequently, you reduce insulin spikes, which in turn can decrease insulin resistance and lower the risk of diabetes. The approach I recommend, and currently follow, involves eating 1.5 meals a day. Here's how it works. Have your main meal around noon, including protein and fats. Then, for what I call the half meal, usually around 3 p.m. or later, like 6 p.m. if that suits you better, focus on vegetable carbohydrates. For this meal, I typically have a large salad, about 7 to 10 cups in size. It's mostly greens, but I add variety with different types of lettuce or sometimes denser vegetables like cabbage, though, in smaller quantities. I dress the salad with olive oil, sometimes apple cider vinegar or balsamic vinaigrette, and add some seeds or nuts. This eating pattern allows for a long fasting period, about 21 hours. Despite having eaten just a few hours earlier, I'm not particularly hungry for the salad, but it's an important part of the diet. When discussing the benefits of eating a large salad, especially in relation to kidney health and diabetes management, an important aspect to highlight is the presence of phytonutrients. These are not just your regular vitamins and minerals. Phytonutrients offer unique benefits. One of their key roles is providing nephroprotection. They help safeguard the kidneys against damage caused by oxidative stress and the complications arising from high blood sugar levels. Imagine two people with diabetes. One follows a diet low in phytonutrients, while the other consumes a diet rich in these compounds. Both individuals might still have diabetes, but the one with a high intake of phytonutrients is likely to experience fewer complications. Phytonutrients have antioxidant properties that help mitigate the damaging effects of high glucose levels in the bloodstream. This is a compelling reason to include a large salad in your daily diet. Not only do you get essential nutrients like magnesium, vitamin C, and potassium, which are crucial for kidney health, but you also benefit from the protective qualities of plant nutrients. However, it's important to note that in cases of end-stage kidney disease, dietary needs can be different, and it's essential to consult with a healthcare provider. Generally, getting potassium from food sources is recommended, and plant-based phytonutrients should be a key part of your diet. There's a particular remedy worth mentioning for those dealing with diabetes-related complications, including kidney issues. It's called benfotiamine, a fat-soluble form of vitamin B1. This supplement is known for its effectiveness in reducing complications associated with diabetes. It works by lessening the effects of glycation, reducing oxidative stress, and protecting cells. Benfotiamine is especially beneficial for conditions like peripheral neuropathy, which affects the nerves in the feet, and diabetic retinopathy, an eye problem. It's also helpful in reducing damage to the kidneys caused by diabetic nephropathy. Typically, the recommended dosage is around 300 milligrams, taken 4 times a day. Another supplement that can be beneficial is alpha-lipoic acid. While it's not essential if you're following the other recommendations, it can further help in reducing diabetes complications. Additionally, turmeric, which contains a powerful phytonutrient called curcumin, is effective in alleviating various symptoms and complications of diabetes. The key to managing these issues is not just in reducing carbohydrate intake, but also in addressing the root cause of the problem. This is where adopting a ketogenic diet and practicing intermittent fasting become crucial. They help correct the underlying issue, while also mitigating the side effects caused by high blood sugar.